With the recent extension of the COVID-19 vaccination exercise to persons aged 18 and above, health authorities are anticipating that the number of recipients will be maximized over the next few weeks. Health Minister Dr. Frank Anthony said on Friday that the decision to make the vaccines available to young adults is in an effort to bring about the much-needed push towards ending the epidemic, which has infected more than 11,000 persons to date. Nationwide, herd immunity, according to the health minister, will represent a more definitive end to COVID-19. Herd immunity is achieved when the majority of a population becomes immune to an infectious disease through vaccination, thus preventing the spread of the disease. For Ghana to achieve this important landmark, 80% of the adult population will have to be fully vaccinated. Minister Anthony added that since none of the existing vaccines being used in Ghana have been approved for children below 18 years of age, that section of the population will not be catered for.
If we remove those persons from the equation, then we're probably looking at about 500,000 persons. And as of yesterday, we would have completed more than 73,000 doses of or 73,000 persons receiving their first dose. So that would get us up a little bit higher. We are working to get as much vaccines in as possible for the entire adult population of Guyana.
There is still in excess of 400,000 persons left to be inoculated. Meanwhile, a recent analysis of those who have recovered from the disease by the Ministry of Health indicates that the virus is increasingly targeting the younger population.
The 20 to 25 age group, we have had in excess of 1,500 infections. The 25 to, say, 30 age group, we would have had more than 1,600 infections. And the 30 to 35 age group, again, that would have been probably about 1,200 infections. So when you look across the age spectrum, you would have seen a lot of infections in the younger group, from 20 to, say, 35.
Although the chances of becoming infected with the virus after being administered the first dose of each of the vaccines vary, if one gets infected, the symptoms are expected to be mild.
It would be symptomatic treatment. So if you get a fever, we'll treat for a fever. If you get a little bit of coughing, that, they treat for that. So there's no special treatment. We haven't seen after, or if after the first dose, somebody end up with, say, moderate infection or, let's say, moderate to severe disease, and those would be very exceptional circumstances.
Meanwhile, in delivering remarks during the Economic and Social Council, which convened a special high-level meeting on a vaccine for all on Friday, the minister reiterated the call for equitable access to vaccines in CARICOM member states.
In order to lessen the impact of the pandemic, to protect our citizens and to bolster the economy. Unless safe and effective vaccines are made available, affordable and accessible to all, many vulnerable countries and peoples, including us in CARICOM, would continue to suffer.
Temika Rodney reporting for the HGP Nightly News.